I get to help build and be part of the rural health network or the underserved network, the safety net clinic network. And it's something that maybe the first year I was there, I wasn't sure if I was going to stay because it's a challenge financially, huge challenge. But now that I've been there, I couldn't imagine being anywhere else. What we find in rural areas or in underserved areas generally is that because you are relying on state Medicaid or state lines of business, CHP is another state line of business, that you have to be very creative in terms of how you use your resources. You're not going to get as much money for each patient that you see. I never went into this, like most doctors say, we're not businessmen, we didn't go into this to be businessmen, but what you find is you have to address that part of it. Otherwise, you cannot deliver the services that you need to deliver. We've reached out, we use lots of foundations and state funding and grants, and we try to be progressive that way. We try to be at the forefront of that, but I'll tell you, it's a challenge. We're, year to year, especially with the changes coming in healthcare, we're not always sure exactly where we're going to be in a year. I cannot imagine a more rewarding way to practice medicine than to practice in a rural community. I think the communities are really, really rich and rewarding places to be. I wasn't used to going out to the grocery store and having to wave to 5 or 10 of my patients every time I go out. And so if you're someone who wants to hide out in the crowd, maybe this isn't for you. But I love it. You're someone who's important because you're contributing to the community. I think most of the people who are here and have come to the rural communities that I'm practicing in, they stay. And I think that says something. They're not just one and done. They come and they stay because there's something, they fight for what they have there because they really think it's worthwhile. If it weren't for the few groups of committed physicians in these rural areas, people would have nothing.